Hello doctors, welcome back. In this video lecture we will discuss the axillary artery. The axillary artery, it is the continuation of the subclavian artery. So this artery continues from the lateral border of the first rib and it ends up to the inferior border of the teres major muscle. Now student, the axillary artery has three parts. So the first part is up to the superior border of the pectoralis minor muscle. Student, this is the pectoralis minor muscle. So the first part runs from the lateral border of the first rib and ends at the superior border of the pectoralis minor muscle, while the second part lies below the pectoralis minor muscle. So the third part that runs from the inferior border of the pectoralis minor muscle and it ends up to the lower border of the teres major muscle. Now student, the branches of the axillary artery. So we will discuss the branches of each part of the axillary artery. So first we will discuss the branches that arises from the first part of the axillary artery. So it is quite simple that from the first part of the axillary artery only one branch arises, while from the second part of the axillary artery two branches of the artery arises, while from the third part of the axillary artery three branches of the artery arises. So first we will discuss the branch that arises from the first part of the axillary artery. So this is the first part of the axillary artery, and this artery arises from the first part of the axillary artery, which is the superior thoracic artery. Now student, this artery supplies the pectoralis major muscle and minor muscles. It also supplies the serratus anterior and intercostal muscles. Now student, moving toward the second part of the axillary artery. So first we will remove this pectoralis minor muscle. So student, as you can see here, the part from this to this, it is the second part of the axillary artery, and here it gives rise to the thoracoacromial artery. This highlighted artery is the thoracoacromial artery. So student, further this thoracoacromial artery gives rise to the four branches. The first branch that runs superiorly to the acromium region, it is called the acromial branch, while this artery or this part that runs toward the deltoid region, so it is called the deltoid part of the thoracoacromial artery. Now student, this part that runs to the clavicle bone, so it is called the clavicular part of the thoracoacromial artery, and this part which runs toward the thoracic region, so pectoralis region, so it is called the pectoral branch of the thoracoacromial artery. So we have four branches from the thoracoacromial artery. Number one, the acromial branch, the deltoid branch, clavicular branch, and the pectoral branch. Now student, the second branch from the second part of the axillary artery is the lateral thoracic artery. Student, this artery supplies the serratus anterior muscle, pectoralis major and minor muscle, subscapularis muscles. Now student, moving toward the third part of the axillary artery. So as I have said that from the third part of the axillary artery three branches of the artery arises. So as you can see, these two arteries, the one that lies anterior and another that is located posterior to it. So the anterior artery, the anterior part is called the anterior circumflex humeral artery. It is called the circumflex artery because it wraps around the humerus bone, and the artery that is located posterior to it, this artery, this is called the posterior circumflex humeral artery. Same, this artery also wrap around the humerus bone and they form the anastomosis around the head of the humerus bone. Now student, the third branch is this artery which is called the subscapular artery. Student, this artery supplies the scapular and the deltoid region.